Hello, everybody. I have a very special day today. I have a guest here from Manila, my friend Mukesh, that we know each other for, I even don't know to think about how many years, over 35, 36 years. I was used to live in Manila at that time, and I was doing research in fake healing. And his mother, which was my auntie, NC2, which was an angel for me, she brought me all over Philippines just to find out that fake healer and to research and to understand what was that miracle. It was amazing stuff. I went there for 1 or 2 months and end up staying more than 7 months. Hardly they let me leave. Mukesh at the time he was doing basketball in national team, and he's looking much better than now. At that time he didn't have that belly, so that right now he just said that he looks better with a belly, whatever he wants. So we have some nice discussion. He wants to kind of interview me in regard wellness, right? Health wellness, and specifically uh, I would say that discussion that we're going to have. He will provoke me, has me question about the prostate because everybody, most of the men after 50, they start developing different prostate problem, and unfortunately end up to cancer. So many people die for that things, and of course the medical science help a lot, but it's an easy way to treat it, easy way to prevent it, and Mukesh wants to know more about. Okay, Mukesh, did I say anything wrong here? I don't anything wrong I said about your belly, but doesn't matter. But you're gonna die, so you'll lose it. So, but you think you look better, more
Make it
roundish.
clear, diet, not die.
No, diet.
Okay.
But what I would say that I think you look very good with a roundish belly like that. If it was square, it was not so attractive, but there was a roundish belly, a little bit belly there. You look quite sweet. I'm sure all the girls are very much in love with you, and even that was his belly, because you're a great guy. Okay, so what is the first thing that you like to know, Mukesh?
Yeah. Well, in our earlier discussion, we had a short discussion earlier today, and I was telling here Dr. Christian, my health and wellness doctor for the last 40 years, that many men, even 40, between 40, 45, 50, are starting to have health issues, health concerns about their prostate. So today was a perfect day to have some discussion so that we can bring out the topics and concerns of the young men out there who are concerned about their frequent urination or having sexual dysfunctions and many other concerns with regards to the health of our prostate, especially all the men. So maybe Dr. Christian can give us a little background.
Okay,
Yeah.
so my strong point is a cause of disease. So first, I'm going to talk about the cause, why the prostate get sick, why the means they develop a prostate problem, and then I will just go a little bit about the prostate. Probably going to make two separate segments, because then I don't like to be too long. I think 16, 17, 18 minutes will be enough. So it'll be part one, then will be part two. Okay, so I would like to, vreau să vorbesc un pic aici în românește. Îmi pare rău că niciunul din cei care sunt cu mine nu sunt români și nu vorbesc românește, dar asta este locul unde trăiesc eu, America, așa că o să încerc din când în când să vorbesc, să traduc un pic în românește, dar cred că este translation acolo, Google, care poate să traducă. E un subiect extrem de important, special pentru bărbați, dar cred că și femeile suferă din cauza suferinței soțului sau partenerului care este. Așa că din când în când o să mă întorc un pic în românește, dar trebuie ca să fie cursivitate, trebuie să țin în engleză, deci cam așa, cam pe acolo suntem. Okay, Mukesh, we can go on. So the first things, we said that the first part is to talk about why we get why the prostate
enlargement.
Yeah, why the prostate gets sick. What is the reason? What is the cause of the prostate? Wait, first of all, any fracture on coccyx bones. Coccyx bones is the end of the spinal cord. So many people just fall in about and just fracture that one, that get more curved. So there is a way that we can treat that one just through manipulation to pull out the coxal bones. Now, if the place where it get fractured, due to various reasons throughout life, where the fracture happen, will over there will develop inflammation which travel to the prostate. Now, next one, inflammation from there, it just inflamed going up on coccyx and reach the sacroiliac joints and develop inflammation over there. So that inflammation can go in the hips, can go inside. But there is all the kind of nerves over there. I will not go in details because it's you don't need that. You can find anatomy and physiology in internet everywhere. So I don't waste my time on that one. I will tell you guys what is not known, what they don't talk about. Okay, so first one is the fracture or big trauma on the coxal bones that absolutely that cause tightness in the sphincter and anus, that cause hemorrhoids also, that also can tighten up the prostate. So when the prostate tighten up and staying tense, eventually it start getting inflamed. It got because the prostate what is a muscle. It's like a ring around the urethra. So that ring, because it's very exposed over there, that it's very easy to get inflamed. When it get inflamed, it get enlarged. When get enlarged, it choke the urethra, and at one point, when that is very advanced, it's very hard to urinate. The when they get enlarged, the inside of the ring, it's tightened up on the urethra, on the on the canal where the urine goes out, and the poor men sometimes they cannot urinate. They have a problem urinating, and it's very painful. Now, but let me go back a little bit at the cause. So I kind of jump too fast. So a cause is a sacroiliac problems, but sacroiliac problems, the inflammation where the sacrum joint iliac bones. There is some ligaments over there. Now, over there, develop inflammation quite often, whether from some hip problem or some pulling some muscles in the buttocks area, or very simple, there is a disc problem on the lower back region. So when there is a disc problem on the lower back region, over there, the disc get inflamed, and the inflammation travel down on the sacrum and just reach sacroiliac, and also it affects the nerve the nerve passage that comes out from the sacrum bones, and those nerves get inflamed, get affected, and they affect down there, even the gallbladder. But we are interested now in the prostate. Now, very often, sometimes, when you lift heavy things, you can pull. Is a very fashionable expression. You pull your back. In other words, you don't pull the back, but what you do, the pressure is too much, and the muscles in the lower back region, that muscle left or right, they insert, whether it's the ascending trapezium or the tip of the rhomboid aponeurosis, they just stick on the bones, on the iliac bones, the basin there. They stick with the tendon. And sometimes when you put too much pressure onto the muscle pull the tendon, and it result on injuries on the tendon region. So some people has a pain on the left side of the back, some people right side of the back. So that's inflammation from there. The pain just is a symptom. Tell us there is a problem there. But the inflammation travel down on the buttocks and often affect the iliac joint on that side. But even let's expand a little bit. That problem also can affect the hip, and that is one of the origin of the hip arthritis, cox arthritis. um, so whether the inflammation on the prostate, which affect the prostate, is is a post-traumatical on coxal bones or coccyx bones, the end of the spine, or some inflammation direct from the iliac, sacroiliac joint. The tendon get inflamed and inflame the sacrum exit of central nerve that go down there, or just very simple, all the way up, a big disc problem, uh, or simple, just injury on lateral left or right, insertion of those muscles. There is a sacroiliac, sorry, is the insertion of the ascending trapezium. There is, it's called posterior superior apophysis. Over there, often that tendon gets torn, partially, of course, not much, get injured due to excessive pressure, lifting heavy things too heavy and not being prepared, or just a lateral on the game in iliac bones over there. So that's it's that same the tendon, which or tip of the rhomboid get torn, or partially, of course, affected, and inflame, and the inflammation go down and make its own way. It goes down and affect indirect, but affect the prostate. So as I said, that the prostate is like now I go back to local things. Prostate is just like a small ring, uh, and that's is just to help the means, or just to help to push to push. You see, when you have intercourse, so the sperm, it has to be pushed out by the contraction of the prostate, and also when you urinate at the end, so the prostate is like a muscle contracts and pushing out any leftover urine that is on the canal, on the inferior urethra. So that is the role of the prostate. Of course, it has some other roles, some hormonal roles, and has some other duties, which doesn't is not needed to talk about those. Where I needed, and also um, the prostate anchor on some tendons in the lateral. That's why I said that when there's a hip problem on one side, the tendons, those muscular inflammation over there, travel up and affect the prostate. Now, what also prostate can be affected by the constipation. So if people has problem, with the constipation, so over there accumulate too much pressure, and that pressure create very uncomfortable environment and toxic environment over there. Now, another reason it could be the hemorrhoids. People has hemorrhoids, right? The hemorrhoids has about the same cause as a prostate. It's whether the coccyx injury or sacroiliac inflammation or this problem, but most of for the lower back, most of the causes, as I said before, the tendon of the muscle that's keep the body on a rectilinear position straight up. So that inflammation travel down, and also when the nerve that comes out from the sacrum get affected, so the sphincter, the anal sphincter, it stay very tight, and because stays very tight due to those problems that I just explained before, when stays very tight, some of those muscles, when you want to go to bathroom, you want to eliminate, to move the bowel, to defecate, right? So when you push it, because the muscles doesn't is not that relaxed to stretch, to let things go out, when you push, they get tear, get the muscle itself get torn. So over there, we experience a muscle tear. Sometimes it's bleeding, sometimes not, but that muscle tear try to heal, and it's healing with some excessive conjunctive tissue, and that is become that hemorrhoids. Now the hemorrhoids, when again, because the muscle doesn't want to expand, being hypercontracted due to that low back problem. This is anatomical part, but there is another part also, which I'm going to talk about. So also when you push those muscles, these muscle sphincter, anal sphincters are very tight. When you push them to really go, push to push out the fecals, right? They don't go. They get torn again, and that have appear multiple hemorrhoids. Now, hemorrhoids, each tear cause inflammation, which inflame the rectum, and down there inflame the anus. So inflame the prostate. So the prostate is bombarded from in and out from anus, so inflammatory process on the anus region, another inflammatory process from the coxal, from the coccygean bones, or from sacroiliac, from lower back, left or middle. All those cause inflammation there, and the prostate get inflamed. When get inflamed, get enlarged. Inflammation meaning enlargement, always get enlarged, because when the prostate tense up very much, so the blood vessel shrinks over there. I mean, the blood doesn't go very well, so then has to be pushed over there. So it has to be pushed, that the prostate start getting enlarged in order for the blood to go through. So that is the prostate enlargement. Prostate enlargement, sometimes it causes it create adenoma, is like a crescent up in the superior part, or even inside the prostate appear some nodules, right? Because when the prostate get tense, get tight and tight and tight, and when you use it in order to push out the spermatoidic fluid in a contact, or or just simple, when you push after you urinate, push out whatever, so it's a hyper contraction. Sometimes those contractions result with some muscle tear within inside the prostate, and remain there some nodule. Those nodules, sometimes for the constant inflammation, it become a cancer. See, now I was telling that the appear an adenoma in the top of the prostate that get inflamed, and that affect the bladder. The bladder is right there on top of the prostate. The bladder where the fluid accumulate, the urine accumulated coming down from the kidney, accumulate over there, and has to be released going down. Now, sometimes the inflammation of the prostate, it inflame there is another ring muscles which close the bladder. It doesn't let the urine to come out. Now, often when it's a prostate problem, sometimes that muscles, the sphincter, that ring muscle at the end of the bladder, doesn't really close very well. Some men start losing urine. It happened that happened with the ladies also, but we talk about different mechanics. um, so that is the problem. Very often for prostate problem, it affects the bladder also. One, the inflammation travel up. Second, the prostate doesn't let the fluid, the urine to go out, and stay there too much, and appear some toxic environment within bladder, and that is another reason that happen. It appear to have a cystitis, to have a urinary tract infection. It is not infected because it's inflammation, simple, not necessarily infected with foreign something. It just it turn some activates some bacteria that are there, that have to go out, stays too much in, and start multiply there, and affect that also
Okay.
bladder, chronic bladder problem. Any question?
Can you? So anyway, to continue, as what you just told us was a lot of the because of trauma and other issues. This has caused the inflammation of the prostate.
Yes.
But are there other,
Side effects?
not only side effects, but are there other reasons like lifestyle? The amount of alcohol people take, or the food intake, and the sleeping habits of the men. Are these also could be reasons of because many men out there are lost. They call it like a crisis, the health crisis, and they are very concerned about this, and maybe you can give
Yeah.
us a little background
Yeah,
on that.
let's say more of this.
Yeah.
Okay, now of course, if you sit, yeah. Okay, so yes, what happened? One other reason that when the area over there is very exposed, like you have a lower back problems or sacroiliac problems, and you sit on a cold stone or cold something, that of course that create a contraction, and that is another reason that affect the anal region and also the prostate. Another thing is another element which is the second part of the cause of the prostate problem is the stress. So the stress, whatever I point out that anatomical problem, they all are amplified at least 50% by the stress. So if you have any low back problem and you get very stressed, so those low back problem get amplified, and the prostate, the prostate, it get affected much faster and much more. If you have some low back problem, but you are very relaxed, you don't have stress, you have a very soft and comfortable life, then there is not she may have some prostate problem, but it's very hard to really get into the cancer. But the stress is the most main
Cause.
cause of the to reach the prostate cancer, and to get the prostate affected very quickly and very in a very large prostate get very quickly large, very quickly inflamed if there is a background of the stress. So I think let me stop here so I continue in a second part. Okay, we'll talk about the stress involvement into the prostate problem. Okay, so you take care and see you in the next episode.